Created every rap that I roll, no favors. I gotta keep grinding till my cousins is my neighbors. Just gotta keep pushing like a lady that's in labor.
Alrighty, so let's get right into the video. We're gonna discuss my labor and delivery experience. My very last OBGYN appointment was on April 24th. I was due April 25th. But just like all of my prior visits at the OBGYN, they checked my baby heart rate and also if I had dilated some, which I was not dilating at all. So I was kind of over it. We scheduled for the following week, which was April 30th, for my induce. The doctor also discussed the induction process. She told me exactly what time I should be at the hospital that morning. On April 30th, I woke up around 5:30, 6 o'clock. We arrived at the hospital around 6:30. I was checked into the women's triage. That's where you would go before active labor. Once I got into the triage, I was instructed to undress, and also they took a urine sample. All right, after I was undressing into a gown, I was asked, you know, what beverage I want to drink. And I was also given a wristband, and also I was given paperwork to sign, and also the nurse will was asking me questions to put into their computer, and those questions go on and on. So be ready, ladies. It's like 200 questions, literally. It's about 8 o'clock then that I'm inside the bed, you know. Okay, so once my doctor arrived, she, you know, checked if I dilated some, and also ordered me to have an ultrasound. Went downstairs, got an ultrasound, came back up. Then once again, my options was discussed with me whether I wanted to continue and get the induction. So I said I want to give it a try, see if I can go through natural birth. So I was like, okay, I want to be induced. So we started the process. I had to get an IV, gotten blood work done, and then I was given my first dose. That was around 11:45 a.m. Once I was given, you know, my first dose, I was instructed to walk for a certain amount of time and then come back. That's what I did. I walked, came back, and they put me back on the machine to like check the baby heart rate and this, that, and the third. Whenever you're laying in that bed, you're gonna be on the machine where the baby heart rate is being monitored. And then I was instructed to continue walking. You know, every so often I stopped walking. I think it was like an hour straight you have to walk. Fast forward, it was time for my second dose, and my doctor and nurses were already in the middle of a emergency C-section, I guess. So I had to wait. So I'm just laying in the bed with the monitor, you know, attached to me, checking the baby heart. So we're just sitting in the room. So soon as my doctor and nurse was available to come and take a look, soon as they walked in the room, the nurse caught it. And she was like, oh, the baby heartbeat is dropping. We have to do, you know, emergency C-section. So that's when I didn't freak out, but my emotions went to running, and our tears started coming because things was just started happening so fast. So soon as that happened, she came straight to me and she went, you know, they have to talk to you. So all I remember was my doctor walking out in that hallway and said, emergency C-section, and it seemed like the world just stopped turning. So many people came in the room and they was just prepping me for surgery, and it was just happening so fast. Tears were just like coming down my eyes. But I wasn't like freaking out, but I was scared, and I was just, you know, listening to everything they told me to do. I made sure I was breathing because I was told that before. They was like, make sure you breathe when you finally do go into labor. So yes, I was breathing. They was telling me to breathe. They was talking me through each step of the way. First, I know one of the nurses were shaving me, and I guess the area where the incision is, she was shaving that area. I also got a shot on my arm. So once they put that into my arm, I just was shaking. I couldn't stop. It was just like a constant shake. Like, oh my God, I felt like a crackhead. I felt like a baser. I don't know, but my body was just like, I guess it made my heart rate speed up. And it was like a million people coming in the room, and then they finally got me into the operation room. And once I got into the operation room, you know, they have to give you a shot in your spine, your spinal cord, your back. They ask you to like hunch over. You basically have to punch. Like, it was so hard with that belly, but I did what I had to do. And then they, you know, laid me down. They was basically prepping. The doc finally came in and they started the procedure, and the nurses talking to me, and then finally my mom came in. Kobe came at 5:20 p.m. He was 7 pounds 15 ounces and 3/4, that which is almost 8 pounds. He was like a little bit from 8 pounds, 18 inches in height, so he was a big boy. But when they pulled him out, held him over curtain, when I heard my baby cry, I instantly was in tears. Me and my mom, we was instantly in tears, and throughout the whole time, mom was holding my hand too. It was so cute. But nevertheless, then once they got him out, him and my mom went over to the scale. They left from the scale, went to the nursery. So, you know, they finished wrapping up whatever she had to do, you know, closing me up and cleaning me up. And they gave me, they inserted a catheter and everything. I didn't know what was going on behind the counter. All I know, I was just being patient, and I was happy that my son was out alive, and he was well, ready to see him. So once they finished doing that, you know, they moved me from the table onto the bed, and then they rolled me into the recovery area. Once I was in the recovery area, the lactation, my mom and baby came out, and I guess they wanted to do the, you know, try to breastfeed. I tried it. I don't think nothing was coming out fast enough, but Kobe was fussy, so I was like, oh no, just go ahead and give him formula. So they left, ended up leaving with the baby into the nursery again. So I stayed in the recovery area. I was with a nurse. So the nurse stayed with me the entire time until they moved me into my postpartum room. Once I was in my postpartum room, they hook you up to a blood pressure machine, and you have to keep that on overnight. One of the side effects after I gave birth, my face was so itchy. I don't know if it was just me or is that something everybody experienced. Please leave a comment below if you experienced the itchiness. Like, my face was, ooh, I was like, what the? I roomed with my baby. While baby was in the nursery, they basically give him a bath. They do a whole lot of little screenings, put eye drops in their eyes. You know, he get his vaccination. They did all of that, changed him and brought him to me. All right, so around 12 a.m.-ish that night, I was cleaned up, which means, like, you know, they cleaned my lower area. So around like 2 a.m.-ish, she finally gave me a Pop-Tart. I mean, after you have a baby, your stomach, you can't hold anything, but it was good to actually be able to put something in there. So I ate probably 1.5 of a Pop-Tart. I was just taking it slow. I kind of was just like munching on it throughout the night. And then 5 a.m. that morning, you know, I had to get up and walk for the first time and also bathe. That was pressure. I got through it. I did it by myself. That's all that matters. You be ready. After, eat a meal, but of course, you're gonna want to go light. So I ordered like a light little breakfast, and then throughout the day I pretty much stayed on my feet, because the longer you sit on a cesarean after having a cesarean, real stiff, real stiff. You don't want to get stiff, because that's terrible. When it's time to get up again, it's gonna be pressure. So it's good to keep moving. You recover faster. And also that's when they give you even more paperwork for you to fill out, you know, while you're there, and they tell you when they needed it. And they also made sure they scheduled my baby pediatrician appointment. That was a 2 nights and 3 day stay inside the hospital. Again, I want to stress how important it is to take a hospital tour. I was so much more comfortable with going into having a C-section because I knew the process. I knew where I would be. I knew where I was going. It just made me feel better about the whole emergency happening, you know? And don't wait until you 8 months like I did. And I also suggest ask questions. Have concerns on how to feed your baby, change the diaper, breastfeed. It don't matter. No question is a stupid question. Ask them why you can, because it's better to know and then to get home and be confused. You know, you're not giving your baby the 100% care that you can possibly give them because you don't know. Baby nursery actually gave me their number to take home, and they said if I have any questions, call them. They gave us this huge water cup. They gave me this squeeze bottle. I probably took home 1 or 2 pads. They gave me this cute little baby birth certificate. They gave my baby 2 books. We went home with a knitted hat, 1 pack of wipes, 1 or 2 diapers. So they gave me 2 prescriptions for pain. I also picked up some softeners because that constipation and gas is real. So I'm gonna let you know now, if you're having a baby, go get you some softeners now. So when you get home, you got them on deck, because that thing hit me so hard when I got home. I was literally in tears on the toilet. Sorry, TMI, but I'm just letting y'all know. Vitamins, you still want to constantly take vitamins on a daily basis. I was also told to use Dial antibacterial soap, maxi pads. That's all I was wearing for like a straight month. My nursery pads, it was a must. And also cabbage. I used cabbage to dry out my boobs because I was not breastfeeding. A 10 out of 10. They did a phenomenal job, okay? I was happy. My kid was happy, of course. My guest was happy. No complaint. And that is all. Make sure you like, comment, and subscribe if you enjoyed my story.